The National AIDS Control Program is now going through the third phase. Within the prevention agenda, high-risk populations such as sex workers, men who have sex with men, and injecting drug users continue to have priority in targeted intervention among core populations. NACP3 has not only emphasized the prevention approach, but has also refined the approach to prevention and thereby moved to a new generation of intervention. After the initial master trainers training, NACO decided to convert the guidelines into video snippets. This is mainly done due to the huge number of outreach workers, peer educators, and other NGO staff whom the master trainers have to train.
Core strategy for the NACP3 and our ability to contain the epidemic is implementing the targeted interventions. That means interventions among high risk and highly vulnerable population groups. But in order to ensure that we can upscale these targeted interventions throughout the country, we need to have an operational guideline that can be easily understood and implemented. And an operational guideline is really to help standardize the operational issues and how we tackle the problems that we face in trying to implement a targeted intervention, and to ensure there's consistency and quality wherever the TI is being implemented. So the operation guidelines that have been developed have been done with a lot of thought, bringing to bear all the experience that we have gained in implementing targeted interventions over the years. Challenge here is to involve the community members to take responsibility for themselves. That is the difference. And the operational guidelines here not only give the rationale as to why it is necessary to have such inclusive set of policies, but it also helps us to give the tools, the skills, the understanding, the knowledge, and the methodologies of how to be able to have such an inclusive, comprehensive approach to targeted interventions.
To prevent HIV, it is necessary to reach the sex workers, men who have sex with men, injecting drug users, and those who are at high risk. Since these people are often marginalized and have poor access to health services, reaching them needs special approaches. WHO has produced this set of training videos to promote innovative and proven approaches to reach sex workers through targeted interventions. The objective is to reach as many sex workers as possible and to involve them actively in response to HIV prevention. WHO is promoting community-based approaches to reach the unreached, not only for HIV prevention, but also for other health problems. The key to reaching the unreached is community engagement. Sex workers who are approached by their peer with information are more likely to listen. They are also more likely to use the condom and more likely to go to the clinic for treatment of HIV infection if these messages are conveyed to them by their peers. It is also critically important to maintain an environment conducive to HIV prevention, particularly with the marginalized population. We are confident that this video series will be an important contribution in the reaching the unreached for more effective HIV prevention.
As a sex worker, I feel that in NACP3, the TI is very crucial. It is both an opportunity and a responsibility on the community of sex workers, MSMs, HIJDAs and IDUs. The TI guideline has put in place the critical community-centric approach that would help stabilize HIV in India. It makes it incumbent for us to acquire necessary skills in implementing targeted intervention. I thank NACO and WHO for giving us, a sex worker organization, the opportunity to jointly produce these training videos, which are a vital link in community learning.